Hey everybody, back in the room now. So was able to speak with the doctor and get the results of the full body CT scan to be able to understand whether or not the radiation is attacking or landing in the right areas to ensure that the treatment is effective. So upon reviewing the imaging, it looks like the radiation is bunching at the liver and the tail of the pancreas, which is where it should be to be able to bind and attack those cancer cells, the ones that exhibit the receptor that it can bind to. So the targeted treatment seems to be at least effective in where the radiation is located right now upon imaging. It also showed that it's not anywhere else, which is also good because it indicates that potentially it's not spreading anywhere else. Because on my last results or blood work results, we saw that the liver markers were actually improving, but that the cancer markers were actually also increasing. I think there was some measure that had increased 20%, but that the which may indicate that, you know, if the liver is improving and the cancer markers are still increasing, then it may have moved somewhere else. But this imaging would indicate that it hasn't spread anywhere else, and it just may be, you know, just variation in the measurement of the cancer markers. So the doctor also said that, you know, upon looking at this imaging versus the last image that they had taken, that she thinks that the liver may have also shrunk a little bit from the last time that they saw it. So all pretty positive signs based on initial observation and conversation. So moving forward, we'll be doing the radio frequency ablation. The doctor said after 2 weeks, it'll be okay to do it pretty much any time. So we just have to align on scheduling with the other doctor who will be performing the procedure. And then also this doctor wants me, or the nuclear doctor wants me to follow up every 2 weeks to be able to check whether or not the treatment continues to be effective in improving my liver function and, you know, at some point reducing the cancer marker numbers. So yeah, all pretty positive at this point. I can even show itself so you can see where, you know, the radiation is bunching in what seems to be the right places. So yeah, all pretty positive. I will, and then also from a radiation perspective, I'm not 100% sure what the measurement is, but radiation wise, I'm still at 0.08, which is safe to be around, you know, normal, uncompromised, non-immunocompromised people. However, to be able to play with my son, I need to be below 0.03. So they'll be running another test tomorrow just to make sure that the radiation levels are low enough to be able to play with my son. And at that point, I'll be leaving the hospital and going home, and you know, just and then it'll be recovery time. I'll likely be weak for a little bit, but after that, after a week or so, or maybe a little bit longer, my strength should start coming back, and taste buds should be fine, and I should be able to work more on health and, you know, getting stronger and fighting this. So yeah, I'm fighting every day. Thank you everyone for listening and coming on this journey with me. Talk to y'all later. Bye.